8:46, almost 8:47 at Indiana in the morning, and we are joined in studio this morning with representatives from IRMC's physician group, and the topic for our conversation will be the community's social services. So we have Rachel Grove. Rachel, good morning.
Good morning.
And we also have Allie Jensen with us, a social worker in the program. Good morning.
Good morning.
Now, there's a lot of information here concerning the Community Choices Social Services Program. Can you give us just a background on what this group is all about?
Well, we started, I'd say about two and a half years ago. It started with just myself. We had a program that was addressing the uninsured needs in the community. And after some changes occurred, they kept me on as a social worker, and we tried to use our resources pretty wisely and brought on some student intern workers, some AmeriCorps workers, and we now find ourselves with 5 employees meeting the needs of the patients of the IRMC physician group.
Social services and primary care, now how are those two linked together?
Well, social workers have had a long history of working in the community, schools, healthcare, all over the place, whether it's adults, children's, families. So in many ways, it's a natural fit just to be in the primary care setting where you're going on a regular basis to see a doctor. You know, their main goals are looking at preventing illnesses, promoting health and treatment. And when you think of why someone goes to the doctors, I've looked at statistics that are anywhere from 50 to 70% of the people that just go to their regular doctor, their issue has a emotional root or a social root to the physical health problem. So it's just a natural fit for a social worker to be there to support that provider to treat the patient.
Yeah, the mind and body sort of connected, huh?
Exactly. They
Now,
call that a biopsychosocial model, where you're addressing all aspects of the patient.
I'll call it the mind and the body. Now, you mentioned that you were a social worker, but do you work with any of the other offices?
We do. Mainly, we find ourselves in your primary care doctor's office, but any of the specialists could make a referral to us, and we also do a lot of work in our OB offices, working with our expecting moms and postpartum. The IRMC hospital does a lot of referrals to us also from their departments, the ER. And even if your doctor is not in the IRMC physician group and we get a referral from you, you know, we will reach out to you and your doctor and see if we can help coordinate your need.
Now, you mentioned new mothers and postpartum.
Yes.
And I think recently there's been news about that also affects new fathers as well. Sometimes,
Sure.
right?
Sure, yes. You know, expanding your family or starting a family can be a big change and a big adjustment, whether it's emotionally or financially. So we can help bring resources to the family and help us certainly with that postpartum depression period of time. And
Now, do you find that occurs mostly with the first child that's born, or can that affect the mother during any birth?
it can be during any pregnancy, certainly. And then, of course, if you had a history of depression prior or you found symptoms of postpartum during your first pregnancy, you know, there's a likelihood that it could happen again. So it'd be important to talk to your doctor about that.
Rachel Grove is a licensed social worker. IRMC's physician group and social services is our topic of conversation of this morning on Indiana in the Morning. What would trigger providers to refer patients to you and your office?
So if a patient presents to the office, you know, really with just coping with everyday problems, whether it's your personal life, family, work life, and you're feeling overwhelmed and stressed, you know, bring that up to your doctor. If there's concerns about safety in the home or a conflict in the home, and that's at any age, whether it's adolescents to the elderly population. If you're been treated or diagnosed with a new medical diagnosis, that would be a point where we could come in. If you're managing a chronic health illness, that would be another point where a social worker would come in. One of our biggest tools is knowing the resources that are in the community. And, you know, it's sometimes people wonder, you know, I had no idea that was available to us. That's what we do. We know what's going on in the community and can make those referrals for you.
Is your provider area just Indiana County, or do you reach out further?
I would say reach out further. Our patients come from outside of Indiana County, the surrounding areas, certainly.
I think you might have already answered this, but do patients have to go through their provider to see you and your folks?
No, they do not. No, they do not. They could certainly call us. They could certainly reach out when they're in the hospital or something like that. The social workers in the hospital will often make referrals to us as people are transitioning back to their home or a different level of care. For
them to contact you, they need to do what?
Well, a couple of different ways. Our phone number is 724-427-2763. One of the other easiest ways is when you're at your doctor's or you find yourself at the hospital or someplace like that, just ask them, can you get me in contact with the outpatient social workers? We would be happy to talk to someone.
I also have a number here, 888-452-IRMC.
Yes, that's our call center number.
Okay, that can work as well.
That will.
And in what ways do you support the patients in your office?
So what we are going to do is a variety of things. We're certainly going to make any community resource referrals that you need. If you're struggling with a health condition, we do a little bit of brief counseling with folks. If you have substance use issues, we can connect you to folks that can help you out with that. As I said, helping families during pregnancy and postpartum. We do a lot of education on illnesses and advocacy. And then I would say the second biggest part of our job is addressing the uninsured needs that people have. There are a variety of programs that we can help a patient potentially connect with. And just, I think, navigating the healthcare system in itself can be quite challenging.
Yeah, especially when it seems to change all the time,
It
right?
does. It does. We have to keep up with that, too.
Then you have folks that are coming into retirement age, and they have to make some changes to their health care.
Right, and there's tons of resources to help people navigate that process.
Allie Jensen's a social worker, also with us. Allie, slide up and say hello.
Hello.
How long have you been part of this group?
Just over a year.
Okay.
I started as one of the AmeriCorps workers for last year, and then when my year was up, it's a temporary position, they hired me on.
Okay. So far, what have you enjoyed most about that position?
I think that the most rewarding part of it is just being able to connect people with insurance. It seems, very simple, but if you don't have insurance, there's no way to afford the health care that you need. So connecting people with insurance is simple, but it's very important.
And that is a big, big problem today.
It is, unfortunately.
It even affects people that do have jobs. Sometimes their insurance changes.
Right.
Premiums go up. And especially if you have children that are coming into the family, there's a lot of paperwork, and you folks can help sort that out.
Yes. Or we'll find out who can.
Yeah. What would a visit look like if the folks are coming in and meeting with you? What would take place?
Sure. So if you're someone we haven't met before, typically we will reach out with either a phone call or we'll wait till you're at your appointment, and the doctor will come out. We'll step in. It doesn't have to take a long time, depending on what the needs are. We'll kind of talk about what's happening right now in a patient's life. What is the barriers that they're experiencing, and just get a starting point. Where does the patient want to start with either making some changes or with their needs, whether it's housing, financial needs, transportation. We just need to find what a starting point can be.
Now, this program has been in effect for how long?
I would say probably 2 years, 2.5 years.
Okay, so it's relatively new.
Mm-hmm.
And you've seen some growth in that 2-year period, haven't you?
We have. Like I said, I started with myself. I was actually doing an internship there too, and we were able to utilize AmeriCorps and student workers, and now we have one full-time, one part-time, and we have 2 new AmeriCorps workers right now. So it makes 5 of us, and we can really address the needs. We went from 10 to 20 referrals a month to 80.
Wow, and you've seen lots of benefits to the folks that come by as well.
We have. It's really connecting, like I said, and Allie said, connecting people who are uninsured, finally get to the doctors, whether it's helping someone be able to afford their medications, just getting to appointments, seeing people just feel better.
It's IRMC's Physician Group Social Services. If you need more information, 724-427-2763. And for same-day access and other appointments, 724-888-452-IRMC, or you can also go online at irmcdocs.org. Is that all correct?
That is.
Okay. Well, we thank you so much for stopping by and filling us in on that information. Have a good holiday, too.
Thanks. You too.